Hello, guys. Thank you for coming. I want to go over a quick short presentation on tuberculosis. Want y'all to understand how contagious it is, and over the years, how it has been becoming more and more resistant to the antibiotics as well, and it's taking longer for patients to be on antibiotics. So we'll go through just a brief description of tuberculosis, how it affects the body, the treatment, and some false claims that people think that you need to have it when you're born or there's a vaccine for it. Okay. So tuberculosis, the medical name is a Mycobacterium tuberculosis. It's a bacteria organism that causes TB. It's an estimated 1/4 of the world's population is affected with TB as per the Martini 2020. The prokaryotic microorganism is a pathogen in which bacteria causes diseases in humans and in animals. The prokaryotic microorganism is a pathogen in which bacteria is genetically housed in a true nucleus. So it has its own DNA, its own genetic material. Tuberculosis is an aerobic bacteria, so it requires oxygen in order for it to survive and thrive in the human or animal host. The virulence factors of TB are produced by an individual pathogen to survive and replicate. So that's what it does if not treated. The pathogen uses exposure and adhesion. So it goes through an invasion, which it involves enzymes and toxins. These pathogens achieve invasion by entering the bloodstream, which is effective means of dissemination because of the blood vessels that pass close to other cells in the body. So because it travels very close, it can adhere to the organs. And this is per Parker 2016 in chapter 15. In most forms of the disease, the bacillus spreads slowly and widely in the lungs, causing the formation of like hard nodules, which they call tubercles. And they're large cheese-like masses in the lungs that break down in the respiratory tissues in the cavities of the lungs, so the patients are having trouble breathing because it fills in all the empty spaces. And achieving advancing the disease is the cause of the blood vessels eroded in the patient, and that's where it erodes in the lungs, and the patient ends up coughing up bright red sputum. The immunity to it is that the only immunity we have against tuberculosis is that the humans have their innate immunity, and this is our line of defense, and this is a line of defense in which we are born with. So we're born with this line of defense, and this is what we have, which is a non-specific immunity present at birth, and it's always there ready to act. The body's first line of defense is normal microbiota. The body's second line of defense is when we start producing a fever or inflammation. The pathogens are cell mediated, and due to the absence of our acquired cellular response, there is a limited to no immunity. And due to the absence of the response, association, transmission pathogens is limited. The TB infection spreads through the respiratory tract. So it's acquired, they're microscopic little droplets that are exposed when we sneeze, when we cough, even just as we're talking right now, droplets are coming out from my mouth that you cannot see. And anybody standing within 3-6 feet of me is inhaling these droplets. They contain hundreds of tuberculi, bacilli that may be inhaled even by a healthy person. And this is per the Encyclopedia Britannica 2020. There, the bacilli become trapped in these tissues of the body and are surrounded by immune cells, and finally are sealed up by hard nodule tuberculous. As the infection enters the bloodstream, it causes infections elsewhere in the body. The The most common areas are upper respiratory and the both bilateral lungs. The pulmonary tuberculosis is highly infectious stage of the disease. It can also infect the pleural spaces between the lung, the chest, the wall, cause pleural effusion. That's when you end up getting fluid collected outside of the lungs, causing it's fatal if not adequately treated. In fact, once the bacilli enter the bloodstream, they can travel to almost any organ in the body, including the lymph nodes, bones, joints, skin, intestines, genital organs, kidneys, and the bladder. And in fact, an infection of the meninges, which covers the brain, causes tuberculous meningitis. The modes of transmission is going to be you need a portal of entry, a susceptible host. So the portal of entry will end up being as we inhale it through our nose, through our mouth. And the susceptible host is going to be somebody who's close contact with me or somebody who has an immunodeficient response or who is immunocompromised. The other thing is they also need a reservoir and then a portal of exit. So it comes in, inhale it in, it gets into the lungs, and then we expel it out through our gases. When treating a patient with TB, medical staff need to use the N95 mask, which y'all should have y'all's too, correct? Y'all have y'all's masks with y'all, okay? So annually, all medical staff need to be fit tested for the N95 annually. If the patient ends up having to leave the room, then they are just put on a surgical mask. If any visitors come visit them, they also only given a surgical mask. And the patient also for TB needs to have 3 sputums that are collected and reported as negative before they get cleared from TB. Prevention, there is no vaccine for tuberculosis. The best way for prevention is to wash your hands thoroughly. Again, as everything's come up with this last year, hand washing is your highest priority in order to prevent infection. Covering your mouth when coughing and sneezing can prevent spread. Also, if you are sick, stay at home, and if you need to go somewhere, wear a mask to prevent spread of germs to others. Treatment is going to be tuberculin drugs, which are given, but they're not as effective as they used to be. These multi-drug therapy they decrease the bacterial resistance, have increased bacterial resistance, and therefore takes longer to treat the patients. So at one time it was taking only for a few months. Now it requires the patient to be on these medications for up to 2 years. These medications need to be taken completely into their entirety. And these medications are also liver toxic. So they're hepatotoxic, also can cause some renal failure and ototoxicity as well. So every hospital and every facility should have their policies on how to doff off PPE. And if y'all would like right now, we can go ahead and just put on them N95 masks. And what you're gonna do is you're gonna draw the bottom string and throw it over your head, and it goes around to your neck. And then you put the other one on and it goes right above the head, and then you squeeze at the nasal tip. Okay, and again, we're all tested for these, so we should all be wearing the correct size, but it needs to go in the back and the other one over the top. Okay, not crisscross, not hanging to the side. Okay, any questions on the information? Do you understand that having to wash your hands is a priority? Any questions, guys? I can't hear y'all.
No questions, thank you.
All right. Thank you, guys. I appreciate y'all. Bye.